Welcome back, health enthusiasts. Today, we're diving deep into a crucial topic that affects millions of lives worldwide. Get ready for an eye-opening journey as we embark on heart matters, understanding myocardial infarction and beyond. What is a heart attack or myocardial infarction? Ever wondered what happens during a heart attack? We've got you covered. In this chapter, we'll explore the symptoms, diagnostic methods, and critical differences between cardiovascular and non-cardiogenic chest pain. Stay tuned to discover what your medical professional will do when every second counts. What is a myocardial infarction, or heart attack? A heart attack happens when a section of the heart muscle dies or becomes necrotic as a result of a blood supply cutoff. The coronary artery, which supplies blood to the heart muscle through blood clots, is typically obstructed, leading to a loss of blood flow. Another name for this illness is coronary thrombosis. Distressing signs, including electrical instability of the myocardial tissues and chest discomfort, will occur when it does. The phrase, heart disease, refers to a broad range of conditions and illnesses that might impair the function of your heart. Oxygen starvation is one of the most frequent reasons. This is typically brought on by an obstruction in the arteries that supply the heart with oxygen-rich blood from the lungs. Heart damage from this illness might result in necrosis of the injured heart if treatment is not received. As stated differently, the cardiac cells will begin to degenerate. This disorder is frequently brought on by a buildup of plaque, which is a waxy substance. Plaque accumulation within the arteries can lead to partial or complete blockage of the coronary, or heart, arteries. Atherosclerosis is the term for this illness. Your organs and tissues' blood flow will be restricted as a result. The parts of the heart that depend on this artery will perish if this illness is not addressed right away. The tissues of the heart that were formerly healthy will likewise experience fibrosis and produce scars that prevent the heart from functioning normally. Such a problem can occasionally slip under the radar and be challenging to find. Thus, if you continue in this manner for an extended period of time, numerous heart-related issues will eventually surface. Signs of an MI or heart attack. Many individuals are searching for strategies to prevent heart attacks because so many people suffer from them. Prior to that, though, we want to become familiar with the warning signs and symptoms of a MI or heart attack. Heart attack symptoms can differ greatly from one another. For example, you might be experiencing little chest pain, but someone else might be experiencing severe pain. Typical signs of a heart attack in both men and women include sensation of pressure, heaviness, or even discomfort in the arm, beneath the breastbone, or inside the chest. Pain that travels to the jaw, arm, throat, or back. Experiencing indigestion, fullness, or even a feeling of being choked. Sometimes it could feel like heartburn. Sweating, nausea, vomiting, and dizziness. Severe dyspnea, trepidation, or weakness. Pass out or go unconscious. How is a heart attack or MI diagnosed? Every year, thousands of individuals suffer from heart attacks without even being aware that they are at risk. Since most people who have suffered early-stage heart attacks are asymptomatic until the crisis occurs, they pretend nothing has happened. Consider it a ticking time bomb. We examine a person's symptoms to see whether they are experiencing any ailments. Each person experiences a heart attack with different symptoms. They could be minor or serious. In addition, factors such as age, gender, the existence of risk factors, and underlying medical conditions affect the disease's severity and susceptibility to contract. For example, people with diabetes typically exhibit mild or uncommon symptoms. In any event, you need to seek emergency care right away if you experience any heart attack symptoms. When treating heart attack occurrences, promptness in therapy is critical. In actuality, the likelihood of survival increases with the speed of emergency care. Remind yourself to ask for assistance from others if you're having an attack. When you're in severe pain, don't try to drive or walk yourself to the hospital, as this can just make things worse and lead to more issues. As soon as possible, get someone to call for an ambulance and seek medical assistance. Every second matters, and you can save your life and avoid more damage to the tissues in your heart by getting medical attention as soon as possible. Cardiogenic versus non-cardiogenic chest pain. Over the course of their lives, the majority of people will, at some point, feel some level of chest pain. Given how frequently heart illness is linked to chest pain, anxiety is frequently the source of this. Thankfully, chest pain rarely has anything to do with the heart, but you should still take it seriously. Recognizing the variations in chest discomfort facilitates the diagnosis of cardiac conditions. One of the earliest indications that a person may have the condition is pain in the left side of their chest. Finding out if the pain is coming from the heart or anything else is the next step. There are numerous structures in the chest and lung regions, all of which have the potential to cause pain. The muscles and bone joints surrounding the chest are the most frequently affected by pain or tenderness. Although the lungs do not contain any nerve connections that might cause pain, the lining or pleura surrounding the lungs may experience pain if it becomes inflamed or irritated. Another area of your chest that may hurt is the esophagus, or the tube that runs from your mouth to your stomach. Although refluxing, or heartburn, has nothing to do with the heart, it can frequently cause pain that feels like a heart condition. Additionally, the esophagus is capable of producing non-cardiogenic spasms. Chest pain associated with the heart is more common in the morning. A burning or squeezing feeling accompanied by a dull, confined pressure is among the symptoms. People typically discover that the deeper parts of their chest are where the pain is located, rather than just the surface. But pinpointing the exact area of the discomfort might be challenging. The back, neck, head, throat, and even the arms, typically the left upper arm, may all seem to be the source of the discomfort. When someone is in agony and doesn't know where it originated, they frequently say that the pain came out of nowhere. Exertion of any kind, such as digging, sweeping, or lifting a large bag, can cause chest pain. A heart attack can also result from working or exercising in extremely high temperatures. It may also happen after engaging in strenuous physical labor and a large meal. These kinds of discomfort typically last as long as you continue your physical activity, but if you cease the activity that caused them, they normally go away very soon. Lying down can exacerbate certain types of heart-related pain, such as angina. However, standing, sitting, or even leaning into the painful spot might help relieve it. It is crucial that you get medical attention right away if you experience any of these kinds of pain or discomfort. Most commonly, non-cardiac forms of chest discomfort appear in the late afternoon or early evening. The pain is frequently sharper and localized to one plainly identifiable spot. If you don't do anything special, this kind of pain usually happens without any particular warning or clear reason. After eating greasy or high-carb foods, heartburn may occur. These kinds of pain frequently come and go swiftly, sometimes lasting only a few minutes or seconds and other times lasting several hours. Easy workouts, particularly breathing techniques, can frequently help reduce or eliminate this kind of pain. Aspirin and heat packs are common analgesics that work well for it. What the doctor will do. A number of questions, including your age and sex, your eating habits, and your medical history, will often be asked by your healthcare provider. In addition to taking your temperature, blood pressure, and weight, they could do a test to find out your body fat percentage. It is reasonable to presume that your pain is muscular if you are a 25-year-old student of martial arts or gymnastics who has recently begun lifting weights and participating in a bodybuilding program. It is safe to assume that your healthcare provider will be searching for a heart-related cause of your pain if you are a 56-year-old male who smokes heavily, drinks excessively, does little physical labor, works in a high-stress environment, has high blood pressure, eats mostly processed foods, and has a family history of heart disease. This is due to the fact that each of these elements raises the chance of having a heart attack. To identify the nature of your issue and choose the best course of action, you will likely be required to undergo a number of tests, including a potential chest X-ray. If you've come to the conclusion that your sick heart is the cause of your chest pain, you should get emergency care right away. Finding the source of the issue early on can help you stop heart attacks altogether, or at least prevent future ones. You will have the best chance of making a full or adequate recovery in the shortest amount of time by receiving therapy as soon as feasible. Let's help save a life one victim at a time. See you in our next video, Severe Complications of a Heart Attack.